Hi everyone, I'm Dr. Marnie Fisher.
Dr. Elena Poulos, and we're here today to talk a little bit about exosomes.
How exciting. This is really the future of aesthetic medicine, regenerative medicine, and we're happy to share everything that we know.
So let's just first start off a little bit, jump in, and let's talk about what exactly are exosomes. So for anybody that's not studied molecular biology, like you've probably heard that word flying about quite a bit and wonder really what is it, what does it mean, and what do they do, and what's all of this hype about exosomes?
Well, they are little membrane-bound vesicles, and they are generally found on the inside of a cell. So as a cell is growing and proliferating, there are DNA, mRNA, proteins that are traveling back and forth from the inside of the cell to the outside of the cell. And so you can think of them as little cars and buses taking these little pieces of tools, growth factors, proteins, back and forth and shuttling them. That's it. That's all it is.
Exactly. So if you wanted to do like a little visual, imagine it's like a teeny little bubble that's formed inside the cell. It makes its way to the surface membrane bound of that cell, erupts out. So this little bubble is like Libby said, like a little bus or a little car. It goes from one cell to the other cell. And in doing so, it carries all of this rich information. So there's proteins in there, there's nucleic acids, there's lipids in there, and those really serve as stimulatory molecules. So it allows the one cell to stimulate the other. So next step, let's talk about what the big hype is all about. So why is it so exciting and interesting in regenerative medicine? So obviously as dermatologists, our primary focus is on the skin and hair. So let's talk a little bit about in the skin. So we do deliver these exosomes to the skin. Usually in order to get it there, we need to create little channels. So on the surface of our skin, we have what's called a membrane type function. And so we have to really kind of get beyond that membrane in order for those exosomes to be able to function. So we usually do that by something like microneedling, or we do a type of laser procedure that creates little microchannels in the skin. And then the exosomes are applied on the surface. And that's what allows the exosomes to get into the deeper layers, into the dermis, into the subcutaneous fat area, where all our stem cells are, where all the viable skin cells are that we want to stimulate for growth.
That brings up a very important point, which is the size. So they're not super tiny like a molecule, but they're not super large. So they do need these little channels that Dr. Poulos was referring to go into the skin to deliver their final signaling pathway stimulus.
So we created our microchannels, we put our exosomes on top, they've delivered down to the deeper layers. So then what happens? So what do we expect to see, or what are we seeing from the skin when we do these treatments?
Well, we see a boost of cell growth, so proliferation of those cells, and then we see a resilience of the skin.
So we know when these exosomes hit, it does stimulate new collagen and elastin production, right? So it makes the skin look firmer, healthier. It's stimulating cell turnover, so it increasing the growth of those skin cells. So we see skin looking a little bit more radiant, so a little bit fresher, kind of like that, just like a child, right? You look at an 8-year-old child that's got all this really flush, healthy collagen, elastin, high cell turnover. Their skin has like a really healthy glow to them, right? So all of a sudden the skin is starting looking a lot healthier. You also get stimulation and growth of new blood vessels in the skin, so new capillaries, which again is going to help improve the flow of blood, oxygen, delivery of nutrients to the skin.
And let's not forget that whenever things are being made new, there's a breakdown and degenerative and regenerative sort of turnover.
Exactly. There's always a deterioration that happens with our tissues, right? So that's why they do turn over time, is that they're not meant to really last forever. So part of these treatments do help to kind of stimulate this like cleanup process, right? So the old tired cells are cleared away, making space for a new
tired cells.
tired poor cells. Okay, let's talk about the hair, right? So it's also becoming a very popular treatment for the hair. As we know, hair for many people, for most people, kind of tires out, right? As we get older, sometimes it's based on hormones, sometimes it's our genetics, sometimes it's just stress, and our hair does not always grow as well as it did when we are, you got that lush head of hair as a teenager. So let's talk a little bit about exosomes on the scalp.
The delivery system must be the same. We must have little micropore channels, either with a microneedling, or there is probably not so much laser treatment for the scalp. It's just a little bit too complicated with the heat and the hair there. So microneedling is probably best to get those exosomes in through the scalp. It's a little bit more ouchy, but still quite pleasant and tolerable. And it's just done in rows, parted through into the thinning part of the hair. So for most people, that's going to be a pattern on the crown to a certain area.
Yep, right on the front, on the top, in the back, where people notice some thinning.
And it can be combined with other modalities as well, which we also really love in the clinic. So you can have a topical or an oral prescription medication on board, already priming the hair follicles, and then add in the exosomes in one of our hair programs.
And then we find really what's happening, right? So people often ask, well, really, what are these treatments doing? So as you described, right, first we're creating the channels, which is a pretty simple microneedling type technique. And then the exosomes are applied just on top of it. It's like a liquid solution that gets applied on top. They get absorbed through the channels. And again, you're getting this stimulation that's happening. So in our hair follicles, we know hair follicles, they go through cycles. So often there's a lot that are just lying there dormant. So the exosomes help stimulate them from going to a dormant state into an active state where you'll see new hair growing in. It also can help sort of reverse the process of miniaturization or micronization. So we know that as a hair follicle deteriorates, either with age or because of hormonal influences, that hair follicle starts to shrink and become mini incised, which means then that the hair that grows out, instead of being a very thick and healthy hair, becomes really fine. So we know that under that stimulation that happens with exosomes, that process actually can be reversed and you're getting healthier hair growing in.
And hair does take several cycles to see the results of changing that wispy fine hair into that terminal hair, for sure. But the results are quite amazing. People are feeling thicker hair, more dense hair, and more coverage.
Just overall healthier.
And healthier.
Yeah. Our process always starts really right at the beginning, which is taking a close look. What are the factors involved? Really, what's the diagnosis? What is the patient's underlying health? What can be done to kind of boost it from a health perspective? So is it related to stress? Is it related to hormones? Sometimes we're looking at adding in systemic or oral medications to patients that may need it. Sometimes we're looking at adding topical therapies, and then we're adding in these adjunctive therapies. So things like PRP, things like exosomes to help boost it once we've made the diagnosis and we know the patient's on the right track.
I like to think of it as a reset for the hair. So you reshock the hair growing cycle, and between some of the topical medications and say exosomes or PRP, those hair follicles start to grow again.
Exactly. And I'll just say really that there is really a lot of hope and there's a lot that can be done, right? And it's just a matter of really following a correct process.
So why are you and I sitting here today talking about exosomes, yet so many people were talking about them sort of 6 and 7 and 8 years ago? What was happening all that time?
So let's talk about sort of the dark side of exosomes. So we've known about exosomes for a long time. So there's been a lot in the scientific literature about how regenerative exosomes can be, how it can take old, tired, degenerative tissue and make it healthy again. So whether that's skin, that's hair, but that's inclusive of other organs in our body as well. Let's talk about the problem. So really the problem with exosomes is that they've been very poorly regulated over time. For example, there have been examples of human exosomes being used that were derived from human placenta, from human colostrum, which then, you have to ask, where are they getting this human placenta, human colostrum? Where is it coming from? And obviously very, very concerning.
Right, so an exosome is not a living cell, it's a nucleate and it's a small particle. However, inside of a cell, you can have viral particles that are also very, very, very small. And the question is there a absolutely 100% quality check guarantee that these sources are completely vetted and viral free, virion free, particle free, and then maybe even a small chain of oligos or mRNA that don't have the things that we don't want to introduce to our own bodies.
Exactly. So really the reason that we stayed away from this whole line of treatment for so many years was because we didn't actually believe in the products. So until we have a product that we feel is really 100% safe,
Yes.
right? So we do not actually want to use any exosomes that are derived from people, because we know that people, we're all exposed to viruses, virins. We don't actually really know what's living in there. So we certainly would not want to take something in and then introduce it to another person. So we've dug deep into these companies that we really believe in their products. We believe in the safety. We are confident that we're not going to be transferring material, genetic material, viruses, bacteria that we don't want in our bodies. And of course, we've tried them out ourselves to make sure that we like them.
We did the most important study ever, which is always the split face.
On ourselves.
Exactly. One product on one side, one product on the other.
Yeah, exactly.
So we tried it. We loved it. And basically, we're going to offer the Purosomes, which are a bovine-based exosome for application after our treatment. So it can be used as an add-on. It can be used as the sole treatment modality that somebody wants. It can be used as an add-on after lasers to boost skin reepithelialization and glow and healing. It's fantastic.
So with microneedling or by creating laser channels, it helps make your skin look fresher, little fine lines, improve the tone and texture across your skin. We always think the best areas is face, neck, chest, and then on the hair, again, through microneedling to help stimulate and boost hair. So it's a super safe, easy, quick in-office treatment, really little to no downtime. If you feel like you're looking a little bit maybe tired, dull in the skin, hair is looking a little bit limp, needs a little boost, think about it almost like a way to supercharge a workout for your skin and your hair.
Little spring fertilizer maybe.
Exactly. Yeah, it's like a immediate little boost. Spring, summer coming up, fall, all of the events like weddings that are coming up, other special events. This is really a nice, easy way that you can get a very quick, instant result.
It's fantastic, and we're excited to bring it in.
So excited. Just remember, you just do your due diligence. That's what we're here for. You have to feel really confident with the source and know, obviously, safety always has to come first. If you have any questions, we're here for you. I'm Dr. Elena Poulos.
I'm Dr. Marnie Fisher. Thanks for watching. Catch us in our next video.